Dr. Joel Shumway from Shumway Dental Care. It's been a while since I've done one of these videos. For the last 3 months I've been away for the Army Reserves. I was actually deployed, a stateside deployment up to Wisconsin. Up in Wisconsin I was a dentist for treating soldiers that were returning from Afghanistan. One of the first things that they need to have done is an exam. If there's a lot of dental treatment, we try and do as much treatment as we could. It was 3 months of a lot of in-processing, soldiers coming in and out. I think over the 3 months there were 9,000 soldiers, so we were very, very busy. But it's good to be back, and hopefully that's the one time I have to go away. While I was there, I met a soldier that kind of got me thinking. When he sat in my chair for the exam, he was hunched over, and I noticed he was crying. And he's a 20-something-year-old, just got back from Afghanistan, and he looked up to me and he said, "Sir, I would rather be shot at than be in the chair with you." And I thought, wow, this is probably the most dental-phobic patient I've seen. And so I spent probably 15 minutes. The nice thing about the Army is I don't have to worry about time. I can take as much time as I wanted to. Probably just 15 minutes just talking to him. Find out where he's from. We got to have a pretty good rapport, and I said, "Are you ready to do the exam?" He said, "I suppose." And then, unfortunately, he needed a lot of work. And in the Army, if you need a lot of work, we're going to try and get it done. And so I told him, I'm happy to do it for you. I'll take as much time as we need. We're in no rush. But the Army's going to want you to get it done. And he said, "Okay, let's do it." So we scheduled him for like 3 or 4 hours the next day. And the whole night I kept thinking, he's not going to show up, he's not going to show up. But the next day he did show up, and the first thing he did, he started bawling. The soldier that comes back from Afghanistan, who knows what he went through, he just did not like being in a dental chair. And I thought, we're not going to be able to do it. But we started talking again, and after about 30 minutes just talking, he said he was ready to go. And I numbed him up, and after about 3 hours of treatment, we were able to get done all the work that needed to be done. Hopefully it's changed kind of his perspective on dentistry, and hopefully it helped him for when he gets home get kind of back on track. Here at Shumway Dental Care, we're committed to providing the best treatment we can. If you're nervous, if you haven't been to the dentist for a while, give us a call. We'll take the time that we need to make you feel comfortable and do the best that we can.